Let's start from introduction. So firstly we will see that who are scholar or school children. So children between the age of 5 to 17 years are school age children. It means up to 12th classes. We also completed our 12th at the age of 17 only, but nowadays it's not like that. 18, 19, 20 years children are also in 12th classes. We cannot say that, but up to 17 means average is for completing 12th is 17 only. After that only we can take admission in any college. So age group between the 5 to 17 years are considered as school age children or scholars. School health services are for them only. Second point is about 30% of the population is comprised of this age group. It means the population of India is rising day by day, that we all know. Current population is 130 crores, whose 30% around 40 crores come under this age group. So for school health services we have to see what is school, what is health, what is school health services. So first one is school. School is a defined as an educational institution where group of peoples pursue defined studies at defined level, receive instruction from one or more teachers, frequently interact with other officers and employee such as principal, various supervisor, instructor and maintenance staff, etc. Usually housed in a single building. It means school is educational institute where the group of students are interacting with the teachers and other officers such as principals and various supervisors and maintenance staff to develop their skill, knowledge and behavior and personality. And one building should be there to say that it is a school. So next one is school health. School health refers to a state of complete physical, mental, social and spiritual well-being and not merely the absence of disease or infirmity among pupils, teachers and other school personnel. As we all know the definition of health. So in school health mainly we are focused on the complete physical, mental and social and spiritual also and spiritual well-being of school health personnel. It means teacher, student and the maintenance staff of the school. So other one is school health services. So school health services are provided mainly based on the needs of the school health personnel, means students, teacher and other staff based on their need to promote the health, to prevent the diseases and diseases, mainly communicable diseases. We have to provide the school health services, and practically it refers to providing need based comprehensive services to pupils to promote and protect their health, control diseases and maintain the health. It means that practically we are focusing on the children's only to provide comprehensive care to them and promote and protect their health and control diseases to maintain the health of the children. So now we are going to see that school health services in India. So it is divided into two parts. One is before independence era, it means before 1950, and second one is post independent era, it means after 1950. So other points we will see now. So if we are talking about school health services in India, in 1909 first time medical examination of school children was done in Baroda city, and in 1957 school health education project was set up by WHO. And in 1960 the Ministry of Health, Government of India set up a school health committee under the guidance of Srimati Renuka Rai and then the Member of Parliament to assess the standard of health and nutrition of school children, and they also suggest some ways to improve their health. In 1977, National School Health Scheme was started. In 1979, the National School Health Scheme that was formed in 1977 was handed over to state government. In 1980, a task force was established by the Government of India, Ministry of Health and Family Welfare, to study the progress of school health programs functioning in various states of country to improve the health of children. In 1984 and 85, Delhi had its own comprehensive school health scheme, which is continuing. In 1988, a proposal for comprehensive whole care for children's came into school health services. In 1989, the Central Health Education Bureau, Directorate General of Health Services, has launched an intensive school health educational project at present time that is known as child to child and youth to child approach. So these are the some points that those are saying that how the school health services are developed in India. So now we are going to see the principles that are included in the school health services. So first one is be based on health need of school children. It means school health services mainly based on the needs of the school children. Second one is be planned in coordination with school health personnel, patient and community people. It means that in the school health services, the school health personnel, it means teacher and the maintenance staff of the school, and parents also will be involved, and community people also be have to involve in the school health services. Third point is be part of community health services. It means school health services should be also a part of community health services, because childs are the part of community, so it is also involving the community people, so it should be a part of community health services. Fourth one is emphasize on promotive and preventive aspect. It is mainly focused on the prevention of diseases such as communicable diseases and deviation of normal behavior of children, and promotion of health. The next point of school health services is that emphasize on the health education. It's mainly focused on the health education to promote the health, to protect the health, and to improve and maintenance of the health of children and the staff of school. Next point is emphasize on learning through active and desirable participation. It is also focusing on the active learning process and active participation of the school children into the all activities. Next one is be ongoing and continuous program. It means that school health services is a continuous program, because other programs, if they are achieving their goals, they will stop, but this program is mainly based on the childs and children always will be there, so this is a continuous program. Next point is have an effective system of record keeping and reporting. It means all the school have a effective system of record keeping and reporting. It means that they have to keep some records such as health records, cumulative records. So now we are going to see the major portion of school health services, that is component of school health services. In that some points are there. First one is health promotive and protective services. School health program is also focusing on the health promotive and protective services. In that, first one is wholesome school environment. It means a healthy school environment should be provided to the children. Second one is maintenance of personal hygiene. It is mainly focused on the personal hygiene of children, such as oral hygiene and other. Third point is nutritional services. It is also focusing on the nutrition of the children, and it is also arranging the programs such as midday meal programs and ICDS program. Those are providing nutritional services to the children. Fourth point is physical and recreational activities. School health services also include a component of physical and recreational activity. In physical proper health checkup, routine health checkup, and recreational services also should be provided to the children. Fifth point is promotion of mental health. As this school health services is also focusing on the mental health of the children. Sixth point is health education. They are providing health education to the children regarding some small topic regarding their hand hygiene, oral hygiene, and their food. Seventh point is immunization. School health services is also focused on the immunization of children. They are checking the record of immunization, and they are arranging the immunization programs, so all the children have immunized with the particular vaccines. So the second point is therapeutic services. This therapeutic services involve health appraisal. It means they are assessing the health of the children's. Proper physical examination should be there, and mental examination also. Next one is treatment and follow up. If the childs have minor disorders, they have to treat them, and follow up care is also for them. Third one is first aid and emergency care. First aid and emergency care should be also provided to the children if they are getting any incidents. Fourth one is specialized health services. Some specialized health services should be also there if the child is having any serious illness. So the third component of school health services is rehabilitative services. The rehabilitative services are mainly provided to the physically and mentally handicapped children. Fourth component is school health record. School should have some records, health records, and health records that are mainly concerned with the physical and mental examination of the child, and the information related to the health of the child. So now we are going to see the health problems that are occurring mainly in the children's. In that, first one is malnutrition. Malnutrition mainly concerned with the kwashiorkor and marasmus. Second one is infectious diseases. Children may have some infectious diseases such as smallpox, rubella, and other infections. Third one is intestinal parasites. Fourth one is diseases of skin, eye, and ear. They may have some diseases of skin, eye, and ears. Fifth one is dental caries due to improper oral hygiene. The next problem in the children are behavior problem. In that, first one is antisocial problems. It means against the society. In that, some points are included such as stealing, lying, gambling, destructiveness, and sexual offense. Second one is habit disorder. In that, nail biting, thumb sucking, bed bettings are coming. So some other problems that are occurring in the children are personality disorders such as temper tantrum, shyness, daydreaming, and jealous. And fourth one is educational difficulties such as backwardness in study, school fear, school failures, etc. That are the main problems. The main health problem, it is related to the physical and mental aspect of the children that are occurring in the school health children. So now we are going to see the school health team. The members of school health team are the school principal, the school teachers, parents, community members, children, medical officer, and school health nurse or community health nurse. We will see one by one. So now we are going to see the first member of school health team, that is the school principal. So the school principal have some responsibilities in the school health services. First one is he or she should ensure that the school health programs are approved by the administrative authorities. Second one is he set up a school health committee to work out the school health plan and for the implementation of school health plan. Third one is to ensure that the teachers are well trained for the health care of school children. These are the main responsibilities of principal in the school health service. The next responsibility of principal is provide facilities for the implementation of school health plan and other activities. Fifth one is make sure that proper records are maintained in the school. Sixth one is principals should also ensure that the parents are involving in the follow-up involved in the care of children, and follow-up of children is also done. So now we are going to discuss about the next member of school health team, that is school teacher. So first point is the teacher should daily inspect the children for their personal hygiene and cleanliness. Second one is daily observation of children from the deviation of normal behavior and any communicable diseases or malnutrition if they are having or chances of having. Third point is help in the control of communicable diseases. So the next role of school teacher in school health services is referral of children if they have any problem. So the teacher has to refer them into the clinic for further action. Next point is informing the parent and maintaining follow-up. If they have any problem, they have to inform to the parents and advise for follow-up also. Sixth point is maintaining records of anthropometric measurement and other health records of children. In our college also health record is there, but not anthropometric, but teachers are only taking the health records, same like only. Seventh point is helping in providing safe environment sanitation. It means teachers should provide healthful environment to the children. Eighth point is giving first aid and emergency care to the children if childs are getting any accident or any other things. So teachers are providing first aid and emergency care. So the next member of school health team is the parent. So the first point says that parents also help in the correction of defects. If child is having any defect, parents have to help in the correction of that defect and follow up care of children if they found as sick. Next point is they can help in the formation of good healthful living habits and behavior. Parents are responsible for the habits of children. They can help in the formation of good and healthful living habits and behavior in the children. Third point is through parent teacher association, the parent can be involved in planning, organizing and implementation of school health services. It is nothing but this point is saying that that parents should also will be involved in the school health program. So next we are going to see the community as a member of school health team. In that, first point is providing suitable land for school building. Community has to provide suitable land for school building. Second point is providing funds and labor in building proper school. Communities should provide fund and labor in the proper building of a school. Third point is participation in school health committee or council and contribute in formulation of school health policies and plan. It means community should also involve in the school health program to form the health policies and plan. Next point is participation in implementation of program activities. The policies that are formed, community should also help in the implementation of that policies. Fifth point is motivating parents to send their children to school and take care of their health. It is also helping to motivate the parents to send their children into the school. So now we are moving to see the main aspect of a school health team, that is the children's, because for them only school health services are there. So first point it says that they have to learn the values of medical and health examination. They have to learn the importance of medical and health examination, personal hygiene, good nutrition and environment sanitation. Next point says that they have to cooperate in the various aspect of school health programs. Third point is they have to develop positive habits and healthful living activities. Fourth point says that they have to extend their knowledge to other members of the family and neighbors also. So the next member of school health team is the medical officer. So the main role of medical officer is the medical examination of the student. They have to examine the students for any abnormality. Second point is making diagnosis. If they find any sign and symptom, they have to form the diagnosis. Third point is if they got any problem in the children's, they have to prescribe treatment. And fourth point is referral of specialties. If they find out the problem, they have to refer the child to the specialist doctor. Fifth point is ensuring follow-up of children. Sixth point is initiating promotive and preventive program. They have also initiate the promotive and preventive programs, and they also involved in the school health service. So the next responsibility of medical officer is inspection of school environment and sanitation. They have to inspect the school environment, that the environment is hygienic and healthful for the children. Eighth point is holding meeting with the parents and teachers if they are getting any problem in the coordination with the school health services, or they are observing something in the children. So for this they have to conduct a meeting with parents and teachers. Ninth point is ensuring maintenance of record and report. They have to check the records and reports of the schools, that the schools are properly maintaining the records and reports or not. Third one is evaluation of the program and redefining program objectives and activities. Medical officers should also evaluate the program, that the program is effective for the children or not, and they have to redefine the program's objective if they are not effective, or for remembering the objective of that program, they have to redefine the objectives. So next team member of school health services are the school health nurse, our role only. So the school health nurse is responsible for the comprehensive health of the children. It means the school health nurse should work for the comprehensive health of the child. She take care of all the factors that are involved in the health of the children, such as first point is biological aspect of child. It is related to the physics of the child, means physical problems of the child are going to this point only. Second one is school and family environment. The nurse should also assess the school and family environment to know that the environment is healthful for the child or not. Third point is health knowledge and health attitude of the child and families. The nurse should also assess the health attitude of the child and families, so she can find that they have positive or negative health attitude and lifestyle. If they have negative, she has to change that attitude and lifestyle through the health education. The other role of school health nurse is living activities. And fifth point is personal habits. He has to assess personal habits. Sixth point is health behavior followed by the children, and his or health family members should be also assessed and improved if they are not good for the health. Seventh point is family and individual health history. The nurse should has to collect the individual and family history of particular children. Eighth point is family and community resources and their utilization. The nurse should explain about the community resources, various community resources. Those are for the community peoples, and for their utilization also she had to explain to the particular family of the children. Moving ahead to school health policy, in that first point is health center staff is responsible for implementation of school health program. It means health center staff is responsible for implementing the school health program. Second point says that the school health program is carried out in the school by the health center staff, and they are working with the school administrator, teacher, local government, parents and community, including both agency and student. Third point is priority should be given to school health program at primary school level. It means they are giving priority to the primary school children. So now we are going to So now we are going to discuss the aspect of school health services. So some aspect of school health services are as follows. First one is health appraisal of school children and school personnel. Second one is remedial measures and follow up. Third one is prevention of communicable diseases. Fourth one is healthful school environment. Fifth one is nutritional services. Sixth one is first aid and emergency care. Seventh one is mental health. Eighth one is dental health. Ninth one is eye health. 10th one is health education. 11th one is education of handicapped, and last one is proper maintenance and use of school health records. These are the some aspect of school health services. So now we are going to see one by one. So moving ahead to one of the most important aspect of school health services, that is healthful school environment. Healthful school environment is also consist of many of the points such as satisfactory toilet facilities, pure water supply, good lighting and ventilation, clean environment, restroom and playground, suitable chairs and desks. These are the some points or facilities that is making the school environment as a healthful for the children. Continue with healthful school environment. In that, first point is location. Location should be away from the busy places and free from all hazards. Second point is site. Suitable highland with proper drainage. Land area 10 acre from high schools and 5 acre from primary school. Additional 1 acre per 100 students. It means land area 10 acre for high school and 5 acre for primary school, and additional 1 acre for 100 students. Next one is playground. For a primary school it should be 0.5 to 1 acre, and for a secondary school, it means 12, up to 12 classes, it should be 5 to 14 acre. Infrastructure, nursery and secondary school building should be single story. And second one is exterior walls about 10 inches thick and heat resistant. These are the some points. So next point is classroom. So maximum accommodation of 40 students per classroom. It means one classroom for 40 students. Height of the classroom about 12 feet, and room soundproof and dust proof, and floor should be smooth. It should be soundproof, so disturbance will be not there. Area not less than 480 square feet. Floor space is more than 10 square feet per children. And one point is more, that is verandas should be attached to classroom. Next one is furniture. So preferably single desk and chair should be provided. Single chair and desk should be provided to each student. Next point, the seat should take 2/3 of the child's thigh. Third point is desk should be minus type of proper backrest. Okay, so these are the some points under the furniture. Next slide we will see some other points. Next we have to see the doors and windows of the schools. So first point is combined area should be at least 25% of the floor area. Second point is windows broad at located as 2 and 6 inch from floor. Next point is cross ventilation is mandated, and ventilator area at least 2% of the floor area. It means proper ventilation should be there in the classrooms. Next point is color. The color of wall is preferably. Next we are going to see the water supply in the school. So first one is independent source of safe and portable water supply, continuous and distributed from taps. Second one is eating facilities. Vendors not approved should not be allowed inside school premises. Separate room and midday meal. It means midday meal programs is initiated for the nutritional facility of the students. Toilet facilities for 100 students, 1 pan, 1 urinal for 60 students. Next point is arrangement should be separately made for boys and girls. So these are the some points that are coming under the healthful in school environment. Okay. So the second aspect of school health services is nutritional services to reduce the malnutrition in the school children. In that first one is School Health Committee 1961 recommended the school children should be assured for at least on nutritional meal. It means they assured that a child should get nutritional meal in the school itself. Second point is midday meal program. They initiated midday meal programs, supplementary but not substitute, operational since 1961 under the Ministry of Education. So in the nutritional services they are giving 1/3 of calorie and half of the protein requirements in school. Means if the 1/3 of calorie and 1.5 of protein needs are satisfied by the nutritional services in the school under the school health services. Fourth point is applied nutrition program with the assistance of UNICEF is started. One of the important aspect of school health services are first aid and emergency care. In that first point says that teachers should be trained during teachers training programs or in service training program in the first aid, so they can provide first aid and emergency care if needed. First aid box should be made available in all the schools. And the other one major aspect of school health services is mental health. They are also promoting the mental health. In that first point is the teachers should help children in attending in positive mental health among the learners. It means a teacher should encourage the students in the positively to attend the classes and learn the things. It means they have to promote the mental health also. Second point is suitably modify learning studies initiatives, rest, relaxation between period of intense work. It means they are providing some time for rest and relaxation in between the classes, so they can relax themselves and avoid stress and other situations to maintain the mental health. Next point is instituting vocational counselor and psychologist in school to guide children into their career. It means they are providing vocational guidance to make the students bolder in their future and they can take a decision regarding their career. So next aspect of school health services is dental health. Children are getting many dental problems due to poor oral hygiene and other all things. So in that first point says that dental hygienist and dentist should be employed in the school. Second point says that provision for dental examination should be there at least one in a year. Third point says that during the dental checkup should focus on the prophylactic cleaning and dental hygiene. It means they are doing the cleaning and dental hygiene. Next aspect of school health services are eye health services. Teachers to be trained to detect the refractory error, squints and amblyopia eye infections, and after the detection they have to refer the child for treatment, and vitamin A administration should be done in the school. The other point of aspect of school health services is health education. This should aim at imparting desirable changes among the students. It means we are providing health education to change the negative attitude regarding the health and lifestyle of the child. We have to change the lifestyle of child if the lifestyle is not good for their health. In that we are providing health education on personal hygiene. It includes care of skin, nails, hairs and attention regarding their posture. It means how to stand, how to sit. All these will come in the personal hygiene. Second point is environmental health. We are encouraging the child to part in health activities, visit the community health programs and participation in community action programs. Third point is family life education regarding reproductive life should be provided to the child. In the secondary schools we have to provide education regarding the reproductive life also. The other aspect of school health services is education of handicapped children, in that the ultimate goal is to assist the special child and their family to achieve maximum potential. It means we are providing education to make suitable to the handicapped child and their family. Second point is to lead a normal life. By our health education, they can achieve a normal life. Third point says that to become a independent as possible. We are making the child and mainly the child to make as a self-sufficient. We are encouraging them to do their work by own. Fourth point is to become a productive and self-supporting member of society. It means we are making it as a utilized citizens to the handicapped children also. This is done in a coordinated manner. Really, if we are coordinating, it means school health team members are coordinating with each other, means principal, teacher, community and parents. Then definitely these handicapped children should be as a utilized member. Next one is school health records. Cumulative health records providing pertinent information. Health supervision tool. In that health in schools, cumulative records and health records are maintaining that are acting as a supervision tool. That the supervision tool for the school health services, and also a tool to evaluate the school health services. These were the some points that are coming under the aspect of school health services. So I hope that you all understand the topic. So bibliography, I had taken the content from K. Park book, K. Swankar, Pashwant Thappa, and from net also. So now I would like to give you a look of whole topic. It means summarization. So school health services, in that who are the children are between the age group of 5 to 17 years. In that we have seen what is school. School is an institution where a child is interacting with the teachers and other staff to develop their skill and knowledge. What is school health? It is a health that refers to the children's health. It consists of physical, mental and emotional and spiritual health of childs. School health services refers to the comprehensive services for the children. And we have seen that school health services in India before independence and after independence. And we have seen the objective of school health, that is promotion of positive health, prevention of diseases, early diagnosis, treatment and follow-up of defect. And we have seen the goals of school health services to prepare the younger generation to adopt the measures of healthy life. And we have seen the philosophy of school health, that is a healthy child is mentally alert and he or she will not leave their studies in the minimum illness or sickness. And we have taken the health problems in the school children, that is malnutrition, dental caries and other problems, behavior problems such as habit disorders, nail biting, thumb sucking, bed betting, antisocial problems, stealing, lying, gambling, and infections in the children's health. And we have after that we have seen the school health team. The school health team members are the principal, the teachers, parents, community, school health nurse, medical officers. All these are the children's also. All these are the health team members. We have seen the aspect of community health services, that is health appraisal, remedial measures, healthful environment, nutritional services, dental care, eye care, health education to the normal children, health education to the handicapped children, first aid and emergency management. So these are the main aspect of school health services.